Good afternoon and welcome to the first Webinar Wednesday of 2020. We're excited to have over 200 registered attendees for today's webinar, which is eligible for 1 credit from the ACI. Let's get started by giving one lucky attendee a Webinar Wednesday t-shirt for answering this trivia question. January is National Blood Donor Month. What is the most common blood type in the world? Answer now using the questions feature on your dashboard. While you're answering, I want to remind everyone that our first Expo of 2020 is fast approaching. Our ICE Imaging Expo takes place at the Hilton Scottsdale Resort in Scottsdale, Arizona, from February the 9th to the 11th, which will bring imaging service professionals from across the nation for 3 days of learning, networking, and the latest advances in imaging. Registration is open and you can register for free by using the VIP pass in the webinar workbook, which you will find in the handout section of your dashboard. More details can be found at attendice.com. Also, I want to remind you to save a date for our Spring MD Expo, which will be taking place at the Hotel Irving, California, from April the 20th to 22nd. Registration is also open for that, and more details can be found at mdexposhow.com. Okay, and let's see who the winner of our Webinar Wednesday t-shirt is. And it is, where are we? Daniel Vogel. Of course, the correct answer is O positive. Webinar Wednesday would like to thank our sponsor, Nuvolo. Nuvolo is a modern cloud-based EAM platform that meets the highest standards for ease of use, performance, and online and offline mobility capability for managing clinical equipment for healthcare providers. Visit nuvolo.com for more information. Our presenters today are Kyle Holetz, Senior Solution Consultant at Nuvolo, and Dustin Smith, Director of Central Support, Clinical Engineering at Intermountain Healthcare. Kyle, you may begin whenever you're ready.
All right, thank you very much, Linda, and everyone who's on right now, thank you very much for joining the webinar today. Today, what Dustin and I are going to be going through is really around evaluating contract transitions, both in and out, and around project ROI, right? So evaluating and justifying projects and also measuring their outcomes with a very sort of laser focus around this whole presentation around data governance and how a modern CMMS can sort of help in that vision, right? So first off, I kind of want to just go through a brief agenda to outline what Dustin and I are going to be covering today. Like I mentioned, the goal of this webinar really is to outline the steps and the thought points when transitioning both out or in of master service agreements, minor contracts, justifying projects, or measuring return in general in today's healthcare industry, all with a focus, like I said, on data governance. So to start off, we're going to go through just a brief introduction of Dustin and myself. We're then going to get into defining data governance in sort of 4 main areas that we're going to be covering today. Then we're going to get into how that governance, of course, impacts the data and the outcomes that you're desiring, right? Building a business case around many different processes around contracts, around projects, the steps in that transition, the go live of that transition, and of course, then measuring outcomes. And then lastly, I've prepared a brief dashboard. Dustin and I will be talking about a number of different reports and metrics throughout this webinar, and I've provided basically a brief dashboard to kind of show the operation of some of those reports, and so we'll briefly go through that at the end, and then we'll finish up with some brief Q&A. So Dustin, go right ahead and you can introduce yourself first.
Thanks, Kyle. So I'm Dustin Smith. I'm the Director of Central Support of Clinical Engineering with Intermountain Healthcare. I am a certified healthcare technology manager. I have a master's in business administration and a bachelor's in finance. My background, ultimately, I've been with Intermountain for a long time. I've worn a bunch of different hats. I'm a little over 13 years. I started out in food and nutrition, and I was in food and nutrition for 7.5 years. The last 5 years of that, I was the manager of quality assurance, and I really managed the patient-facing side of food and nutrition in our kitchen. And so that gave me a really strong operations background and where I started to kind of use data to make certain decisions. And then I got my bachelor's degree in finance and transitioned into a financial analyst role and then later on a data analyst role. And then I had the opportunity to come to clinical engineering a little over 3 years ago, where I've transitioned into a central support role, and I really support not only analysts and our service coordination center, but also a variety of different types of engineers. And I'm hoping that gives me the credibility and the background that can really help everybody understand what we're trying to achieve here. Kyle.
Yeah, and thank you, Dustin. I'm excited to have Dustin on this webinar, just mostly because he's a friend, a colleague in the industry, and also just he's in the trenches, going through what you guys are going through on a day-to-day basis, and has a lot of experience in these types of transitions, measuring outcomes, especially with the financial background. So I hope that you guys all find the presentation valuable today. As many of you might know me, I've done a number of these webinars in the past. My name is Kyle Holetz. A little background: I've had around just over 12 years of sort of database architecting and admin experience, a little over 10 of which have come from the ServiceNow platform, which many of you may know is what Nuvolo, our software applications, are built on top of. In terms of CMMS and clinical engineering, facilities engineering, and healthcare, been working specifically in that industry for just over 7 years. Had the opportunity to be a founding team member of another CMMS company. That ends up got bought out, and I've been with Nuvolo for about just around 2 years now. So looking forward to presenting to you all today, and with that wraps up intros, and we can get moving into the presentation. Also, like Linda mentioned, if you guys have any questions, feel free to put them in the question queue, and if they're in line, we can try and answer them as we're going, or we can hold off till the end. So first and foremost, when we're looking at data governance, right, what we're looking at specifically today is wrapped around assets, contracts, work orders, and we'll also be making notes around parts as well. So when we think about governance, right, in the Google definition of governance and data governance, and specifically is the action or manner of governing, right? The way I look at this is it's not just a manner of control and a manner of governing, but it's also a matter of input. It's a matter of controlling workflow, right? We have data points, we have KPIs that we want to gather, but one of the keys to this is making it simple enough so that the technicians and the folks that are entering this data, they're not thinking twice about it. It's not becoming a pain for them, right? So the whole user experience of entering data and driving KPIs rolls up into data governance the way I think about it, right? So when we're looking at assets in particular, we have to know what's most important to us. Believe it or not, I work with most major health systems across the country at this day and age, and it's not the same for everybody, right? Everyone has different points that they want to track against assets. Everyone has different verification processes and workflows to make sure that the data is clean or maybe not so clean. So it's really key to identify those things. And when we talk about projects as well and transitioning of projects, identifying those things in different stages of what's important to you. Knowing what was important to you in a legacy CMMS system before, maybe speaking of a CMMS transition project, knowing what was important then and what's going to be important when you switch are absolute keys to defining how you're going to govern the data and the input into your system. Then once you have identified those points, the next sort of a logical step into that is identifying infrastructure, right? One of the things in healthcare we all know, budgets are being cut, everyone's being asked to do more with less. And one of those things we have to always think about is governance shouldn't make an individual who's already stretched thin or a team that's already stretched thin, it shouldn't make their lives harder. Right? Many times there are software or technology solutions out there that can help in that workflow or help in that process of governance, ultimately pulling some work off people's backs, which is going to provide a better work experience and ultimately driving better talent retention, right? So the other key point into this is dynamic data governance. And you'll hear me talk about this for both assets and work orders, but not all assets, as we know, are tracked the same or should be tracked the same. So one of the key things with this when we're talking about data governance is dynamic policies, right? And the way I think about this, and a good example is network connected medical devices or operational technology in general for the facility side. a device that's network connected, as soon as that hits your system, we care about additional attributes about that device, like MAC address, the operating system, software firmware revision levels, IP address. We care about those things a lot more, and they're a lot more critical than a non-network piece of equipment. And our CMMS and governance structure should embody those different dynamic policies. Next, we're going to talk about contracts and data governance and how that sort of defines or how it's used in data governance. And really, not only is it just tracking contracts in the CMMS, but how are they used? How are contracts visible to all your different areas of business? The way I look at this, right, is starting at the inception of a corrective maintenance work order when somebody calls the call center, right? That call center agent should have visibility that if the asset that the issue that they or the asset they're having the issue with, is under contract, they should be able to see that right away, because that helps them drive their next decision, right, of who they're going to call. Also, having technicians have that visibility on work orders of knowing what's covered, because many times the coverage of parts and labor when it's a preventative maintenance work order versus or a planned maintenance versus a corrective can be very, very different. And then lastly, how are they being tracked in terms of value and ROI, right? So there many times potential savings can be made based on contract scope. Many times we don't always need a master service agreement. Major sites might have the skills and certifications that are needed to handle a workload, whereas rural clinics or rural facilities might not. So we might want to enable sort of minor or local contracts, but ultimately we need the data to back that up, and which is all going to be controlled by, of course, data governance. Lastly, we're going to talk about work orders. This is very, very similar to assets. And what we need to talk about here is the dynamic workflow and dynamic data governance of work orders, right? And the reason being is not all work orders, just like assets, are made the same. Some are outsourced to vendors. We need to make sure that every time that happens, we're getting that field service report and recording those itemized costs on that field service report. The data we're tracking on a corrective maintenance work order versus a preventative maintenance work order should not be the same. And the system should support all those things, and once again, not make it a pain to enter that data that's needed to make better decisions. And then lastly, just being clear, and one of the things you'll hear Dustin talk about later in this presentation is communication. Being clear and upfront with how you're governing data and how you're driving workflow with all individuals across your organization, nurses, floor managers, whoever it may be, is very important. And what this does is it manages expectations from the get-go and allows everyone to know what they should expect, especially around escalations and things like that.
And with that, so a couple of things that you can do to improve governance essentially out the gate: utilize committees. At Intermountain Healthcare, we have a PM committee that not only controls what our PM protocols look like, what the intervals are, whether something's AEM approved, but also what the models look like as they come into the system. And having a model master table is going to save you from a lot of headaches down the road. Depending on the size of your system, I'd be willing to put money on at least somebody on the phone has at least 3 or 4 different versions of GE within their system set up as a manufacturer. And that can create large headaches when it comes to actually pulling down information in the future. So utilizing some sort of a committee setup to handle your new model adds will be helpful. And we also utilize a contract template committee at Intermountain that really assists us with the terms and conditions and the service level agreements for the expectations of authorized service providers that come into our system. So how does governance impact data and ultimately our outcomes? Really, the goal is to create consistent, meaningful, and repeatable data that ultimately leads to a report. So this little comic off to the right: if it walks like a duck, quacks like a duck, denies it's a duck, accuses you of being a duck, disguises itself as a goose, and a bunch of other ducks start dying in weird and dramatic ways, it's a Russian government duck. It's kind of comical, but the irony of this all is we've all created Russian government ducks at some point in time unintentionally because of lack of governance. And it's really unfortunate, but it's easy to do. If you don't have the appropriate business processes in place and the appropriate structures to ensure that you're getting the data you want in unfortunately your output's going to be bad, which is really, I'm comparing to a Russian government duck. So think about that when you're setting up governance structures. And now we'll transition on to business cases and how to evaluate our contract efficacy. So as you're thinking through when we make business decisions, oftentimes we look at contracts that are on full service levels and we start to say, we know we have the capabilities to take this in-house with certain levels of training, and there would be a benefit, whether that's cost savings or downtimes, and you need to start looking at that. So the questions you can ask is, how much is it for full service, and how do you get there? A lot of times that's going to come from your field service reports and the ways you potentially documented that, and that'll help you understand what the cost structures look like there. And then once you have that total inclusive cost, you can start thinking through, what is it going to take for us to transition that somewhere else? Whether that is us, is it a independent service organization? Is there some intermediary? What does that look like, and what's the cost to get us there? And then what do you need? What parts are needed? What tools are needed? And also, last but not least, as you start looking at this, are you going to take on all of a contract? If you look at GE, for example, I'm sure a lot of people out there have contracts with GE. As you're trying to transition stuff down, are you going to eat the whole elephant at once, or are you going to go with a specific area, one of your more populated areas where it's really easy for an engineer to service multiple sites at once? Or are you going to go with a modality approach? In the case of imaging, maybe you're going to take ancillary equipment or general X-ray, but you don't have any desire to touch CT or MRI. These are the things that you really need to start thinking about as you're trying to determine, do we want to transition certain assets from one level to another, and what's it going to take? Those are what you really need to be thinking about. And with that, you got to start to think through what's actually available. And Kyle will walk us through this.
Thanks, Dustin. So yeah, one of the first things that we always talk about, and I can speak from a lot of experience in this, of just seeing what everyone's working with, right, across the globe, realistically. And one of the biggest things is knowing what we have now, right? And what we're going to be talking about in particular today, like I mentioned earlier, is going to align to contracts, parts, assets, and work orders. Most people I work with do a really good job at assets and work orders. Parts and contracts is a little more patchy, right? And the reason is many times we just don't have the clean data, which is a prerequisite of truly making, the best data governance and best transition and best project and measured outcome decisions that we can, right? And we have to be realistic about this is another key point I want to make, because many times, we need to be realistic with where our gaps are, because many times we can fill those gaps and pull the data from somewhere, assuming we're realistic about our gaps, right? Many people I work with don't track contracts and parts well in the CMMS, but there's other ways to get it, right? So having this good historical basis of data will greatly increase your ability to define realistic data governance in all four of these areas. And as we use those in various different systems, right? Because many of contract, parts, assets are used, not just in your CMMS systems, but also potentially in your ERP and others, or supply chain systems. The next piece of this is there are alternatives, right? Of if our data is dirty. Many times I work with customers and they don't track parts, but they're recording when parts are used on work orders, for example. And so with just, small amounts of quantification there, we can eventually find out, based on the number of work orders, looking at that against the modalities of equipment it's being used on, many times through things like tribal knowledge, we know there's a part that is being used on those work orders, say a high percentage of the time, just using parts as an example. Right. And what that does for us then is it gives us the ability to at least have a baseline to go from, so we can start, utilizing or receiving the benefits of making mass part purchases and things like that. Usage is the same, right? Dustin talked a little bit about, where we're geographically locating people. And a lot of times looking at those parts usage can help us drive, where we might want to hold stock rooms or storerooms or things like that, which we'll talk about in a little bit. Additionally, many times we can get a lot of data potentially from peers, right? I mean, speaking of AEM as well, we can use data from a similar make model for things like AEM reviews or AEM plans. Many times we work with a lot of vendors, GE, PartSource, Siemens, Philips, a lot of these major vendors. They can also provide some of this data for you as well. So many times when I work with people, we forget that OEMs and part vendors, they know the parts that they're sending to you, and you can get those lists from them if need be. And if there's an easy, import mechanism through your CMMS, that's a good start, right? We can at least bring those in so you have standardized part names and have a basis to move forward around how you want to govern those parts and transact those parts in your system moving forward.
All right, so after you've gone through, you've evaluated what data you have, and you potentially see an opportunity to transition something, and you really want to start moving that down that direction. The first thing you really need to do is set up your crews. You need to make sure that people are set up in such a way that they can actually service that equipment at whatever level you've determined. And the biggest thing you need to figure out is, who is that person, first and foremost? And then also, where are you going to get the training? Are you going to go with a field service or a local support kind of route? And then you need to start thinking about where you're going to record the cost, because the goal as we go through and transition things, ultimately it's really to try and make us look good and improve the bottom line. So as you're setting up the crew and as you're getting these tools, the training, you need to start recording those costs in a meaningful way. Later on in the presentation, Kyle will talk about ways that this can be done in Nuvolo. Unfortunately, I can tell you within our CMMS at Intermountain, it's been a little bit more difficult, and we've had to actually record that in a spreadsheet. And then later on, you're going to match that up with work order data to ultimately make a make good to show that you've done the right thing. So as you're determining who's assigned to the assets, you really need to think through what level. If you took everything on, it's all going to be your team. If you took on, say, a first look where you're doing PM coverage, then your team's going to take care of the PMs, and you'll go out and look at it for the first corrective maintenance, but then your engineers should know they should feel comfortable calling in either the OEM or a third party that you have that contract in place with. And then as far as field service versus local support, this is always a really interesting area where I think everybody has kind of their own strategy. A good example, within Intermountain Healthcare, we have a sterilization group that services, I would say it's probably 150 miles that they cover, and there's 4 engineers, and they're taking on all of steam sterilization, and they're constantly floating. So that's a field service model. But then when you look at, say, anesthesia, we've made a decision as an organization that we're going to have an anesthesia tech at almost every single one of our acute facilities, and that's to mitigate downtimes. What I've found is, could we do more of this field service model with anesthesia? Absolutely. It is a very real possibility, but we've taken a more conservative approach because of those downtimes, and so we've chosen to take the local approach. These are the things as you're setting up your crews that you'll need to keep in mind, because it's going to determine what strategy you use. How conservative are you? How risk averse are you? These are the things you ultimately need to be thinking about.
Yeah, and just to expand a little bit on that too, the way I look at this is there's not a lot of perfect software solutions out there. I would never be one to say that any CMMS or Nuvolo in that realm is a perfect solution to pulling in all this data, right, and giving it to you in in a justifiable, quantifiable fashion that you might find with like a Tableau reporting mechanism or a BI tool. But what I think is important to note on this is providing you a software solution that is modern and flexible, where you can evolve your business and see these outliers around things like on-the-job training. How much is that actually costing me before I have a technician who's competent in working on a device, right? What are these certifications and skills actually cost to assign to an individual and send them to, a GE factory shop or one of the many different shops that are out there? But having all of this data in one place is very beneficial, right? So all of these things, if the system is set up properly, if data governance is impacted in all of these different areas and it's being tracked in a way that isn't sort of burdening people, a modern flexible CMMS tool can at least get you to the point where all of these things that Dustin is mentioning can be pulled and visualized from one single pane of glass. Right, so we can at least get a handle on this data, begin to quantify it, which is a lot better than a lot of the alternatives that I've seen so far. And then we can always export easily out to those tools where you have a true, total cost of knowing what a full transition across the board from tools to training to asset assignments, right, to field service local support actually looks like. And Dustin, I don't know if you have any, I'm sure Dustin has a magnitude of stories around these types of things, but I can move on if you want.
Yeah, let's head to the next slide. All right, so now that you've got your crew set up in the system, now you can start actually digging into setting up your assets so that they are appropriately assigned to a crew. So the biggest thing is make sure the contracts are in the system in a meaningful way that people can easily visualize. Again, going back to that first look example, is the engineer aware of that contract so that they know that it's not going to cost an arm and a leg when we do actually escalate? Or even warranty work is a good example. Do you have some visibility into your assets that are still on warranty so that the engineer isn't going to spend a tremendous amount of time when they can actually call out the OEM to get that resolved? And then corrective maintenance and PM breakdown, again, it all comes back to that contract level. And so especially on full service, you may have an engineer assigned to that, but they're just a facilitator for something that's on a full service contract. They may be calling out GE, and they need to have the visibility to do that, and then also to hold those authorized service providers accountable. And then once you do have the appropriate engineers attached to the assets, when are you supposed to service these? And this becomes very important when you're transitioning contracts. I know Intermountain Healthcare, we started our chemical sterilization program about 1.5 years ago. And one of the things we found very, very quickly is that, unfortunately, we had mismanaged the field service report documentation. And so almost immediately we found that all of our PM basis dates were inaccurate. And we actually had to reach out to the OEM that we were utilizing for full service contracts before to go through and update all of our PM basis dates so our engineer didn't keep getting calls about stuff that suddenly needed a PM that we weren't planning for, or in the case where he's showing up and he's actually PMing things 8 months early. These are some of the things you just need to ensure that your assets are appropriately loaded once you go live with one of these transitions. Otherwise, unfortunately, it's time lost. And again, with our chemical sterilization program, we were covering the entire state. One engineer was taking it all on. And so there were times where he would drive 120 miles, and then we found that, unfortunately, it wasn't needed. So keep that in mind. And then also, as you're looking at your PM basis date needs, are there meter readings? And if there are meter readings, is that what's determining your PM? And do you have a way to log those in a meaningful way so that you can actually get the PM generated when appropriate? From our system, we can make that happen, but we've actually made a conscious decision not to the vast majority of the time, because we can typically do a frequency instead of a meter reading. And so for CLIA compliance, we'll go through, we'll document what we can and what we need to, but more often than not, from a PM perspective, we're actually using time. And then along those as well, is this AEM eligible? And Kyle's done a tremendous amount of work with partners in the industry to really understand that potential.
Yeah, and some of the things that we've seen is that many times AEMs can greatly help in the areas that Dustin's talking about of transitioning contracts, right? Assuming we have the amount of or the proper amount of historical information to create an AEM program and develop an AEM plan, you know, many times it can help with this transition, because it might make sense to push a certain model into an AEM program, assuming, you know, we can get that data internally, like we talked about earlier, what's available, or even get it from a peer, right? Which we can do, as long as it's not one of the, of course, taboo AEM areas. And many times this can really help us in terms of transitioning smaller contracts into, you know, or excuse me, transitioning major contracts into sort of smaller or minor contracts. I would like to talk about. And one of the things that I see in the industry many times is sometimes people only care to track the major contracts or the master service agreements and these types of things. I'm a large proponent to the fact that we should be tracking all contracts. It doesn't matter if it's a transitional contract or it's something small that we're doing just because, you know, we're working on getting some more models of equipment under an AEM that we can handle in-house, for example. And the reason is because those devices need to be flagged and known by the call center agent, by the field service technician, by the in-house technician, right? No differently than they would if they were in a master service agreement, because they're still covered. And if we can't see that in an easy and meaningful way and govern that process, we're potentially going to waste time, we're going to waste materials on things that have not quite made it to a full in-house program yet. One of the things too that we like to talk about during this is flagging those devices easily, right? And a huge piece of that is notifications around driving contract ROI, and also knowing when things need manual intervention. Right? So many times contracts, you might not get a full ROI out of them. You might miss reevaluation periods and things like that. So creating alerts and notifications that help drive data governance and ensure that there is a level of manual intervention where it makes sense is very important. Those reevaluation reminders, right, and those alerts should always be present in order to, you know, really minimize the opportunity for human error. You know, those are things that a CMMS system should be able to send out to you in an email or a text message that's simple, that lets you know that, hey, it's you know, reevaluation is coming up in a month, in a quarter. We need to look and see if we got the full value. And I work with a lot of people in this where there's a major manual lift to reconcile contracts on a monthly or a quarterly basis to see what that ROI is. The way I see it is all that data lives in your CMMS as long as we can put it together in a thoughtful way to make it easier for you to manage those contracts. We know when an asset's covered under contract. We know when that work order has a contract covered asset. Dependent on the coverage, we should know how much costs are then going back to that contract, giving us an ROI, right? Which we'll talk about a little bit at the end. All things that I think are extremely, extremely important to not only think about when we're improving processes, but when we're also evaluating technology solutions. So as we get into the next piece here, which is setting up parts inventory, one of the things I see a lot in this is, even if we're not always tracking a parts inventory, you know, many times we have some information, at least, you know, from PM part requirements, if part kits are needed. That gives us a basis of, at least from our PM workload, how many parts we should expect to use, or even looking at things like field service reports. Like I mentioned earlier, many times the people that we are ordering parts from, whether it be a third party or an OEM, you know, they can provide lists of parts for us that we at least can start quantifying in some sort of baseline fashion, so we know what, in terms of a sort of average level, what our parts history actually looks like. And speaking of data governance from the first slide, the enforcement of making sure that we are capturing those itemized costs every time a vendor comes in and does a work order for us is crucial, right? You know, it's a very simple step, and it's not a large ask to have someone not just go in and close that vendor, you know, sourced work order, but to actually enter the costs in there. You know, with a good system, that shouldn't take a large amount of time, but the benefit for you know, the clients on the back end and for our organizations on the back end is massive. We can start holding vendors accountable, right? We know exactly what they did, you know, every time they came into our facility. Another big thing with this is simply, of course, tracking history. We can look back, like I mentioned earlier, and see when parts were transacted. So we know based on CMs, at least from a unknown workload level, because we don't exactly know when things are going to break, but we can get an idea of how we can start benefiting from mass parts purchases based on those two areas, mostly around CM parts history and of course, PM parts history. And, you know, the last point on this is one of the things I mentioned earlier. Having some basis of utilization is really important when we're looking at, and Dustin mentioned this earlier, where are we going to locate stockrooms or storerooms, right? Where do we even have the space available to do so? Because a lot of facilities, it might not make sense to have that because we physically don't have a place to store what we need, right? So many times, you know, the utilization and having these metrics will help us make a good decision on where our stockrooms and storerooms should be. Of course, that should be then governed in the system of where you are actually transacting parts in the system and pulling from quantities and updating quantities and creating thresholds to reorder parts and things like that. And lastly, you know, the bottom line is that parts need to be tracked somewhere, right? Whether I've seen people do it in the ERP, I've seen people do it in the CMMS. I'm, of course, a proponent that this should be done in the CMMS simply because then it's your system of both transaction and tracking, right? So it's being done in the same place.
And in ideal situations, really, you have an integration between your CMMS and ERP so that it's actually updating. And then, so next, okay, you've got your assets set up. You've got your crew that is assigned to your assets. You understand what inventory is needed, and you've got that actually ordered. Now you need to start thinking through, what does your corrective maintenance process look like? And really, what does this look like for the clinicians? How are they going to get that message out to you? Are they using some sort of a web service request, and that will automatically route through the system based on the crews that you've assigned and get to the engineer? Do you have a just rough dispatching that maybe it's the same person that dispatches for EVS, safety and security, facilities? Or do you have a dedicated service coordination center that's only clinical engineering? That being able to answer those questions is largely going to determine how sophisticated your system is set up, and especially when it comes to the visibility into the contract. If you've got frontline dispatchers that are doing EVS, facilities, and clinical engineering, odds are they're not going to really be able to understand what type of equipment they're hearing about, and because of that, a lot of the dispatching is ultimately going to be managed by clinical engineering, because they're going to be the one that is aware of the way the equipment works and also those contract levels. But if you have the benefit of, say, a dedicated service coordination center for clinical engineering, then if you have some sort of way for those service coordinators to be able to have visibility to the contract out the gate, they'll do a much better job getting that corrective maintenance out to the appropriate party. And then also service requests, like depending on your system, oftentimes you can get this sent out to the appropriate party out the gate. Where this does get a little bit trickier though is depending on the strategy you're taking, it may be different site by site. A good example within Intermountain, we have our steam sterilization crew that is really taking care of the greater Salt Lake Valley, and we'll dispatch to them through our service coordination center. But when it comes to the rurals, we still have those on full service contracts because, unfortunately, the time it would take us to get down to those rural sites, it pulls those engineers out of the areas where they have the most benefit currently. And because of that, we need that information to show up immediately when our service coordinators are actually trying to dispatch for that. That's a good example of a certain corner case where it is slightly different in terms of your service request setup, and you'll need to think about that.
Yeah, and I think that that's a fantastic point of just knowing where your corner cases are, of where different strategies need to be employed, right? And to take it back to data governance again, also reporting on and governing and auditing where those corner cases take place and how often, right? Because with that, we can ensure that A, process is being followed, B, it's actually working, and C, if we need to evolve or change that process.
All right, and then, okay, now you've gone through, you've set everything up. The biggest thing as you're going live, over communicate. You can never reiterate the expectations for both the clinical staff or the engineers too much, and you're going to need to continue to do that because it's really a learning experience. As you start to transition contracts or take on certain projects, you just need that back and forth communication to ensure that everybody's always on the same page. You can see everything that's on the screen right now regarding engineering clinical expectations, but I'm going to quickly go through some of the learnings that we actually encountered as going through our chemical sterilization program launch. All right, the first thing I did wrong, we only had one engineer trained, okay? And this is still a problem to this day. He's essentially been on call for a year and a half. Please do not do that. I did send another 2 engineers to training, and unfortunately they didn't get in quick enough to do any PMs, and so they lost that hands-on experience they needed to truly be proficient. And so I've got somebody out on an island. Another thing that was a bit of a mistake is we didn't have clear expectations about when to escalate. As you transition contracts down, until you get that experience that makes everybody 100% competent and totally confident in themselves, you're going to have to call in the OEM, or you may have to call in a third party, especially in that first year. Set those expectations with your engineer. Let them know, yeah, a lot of times we're doing this to minimize downtime and also to generate savings, but at the end of the day, we need the clinicians to feel 100% confident in the service that their assets receiving, and we need to be able to pass on the tools for engineers to be successful. And oftentimes that's saying it's okay to call somebody in. We know it's going to be expensive, but over the course of 3-4 years, all of this, it's essentially going to level out. Another thing that a big learning was just to communicate with clinicians. The first time we did have an escalation call, it was a little heated for a minute. Central processing, they were a little concerned and they had their frustrations, but after talking to that site manager and then also following up with them a couple of months later, one of the things that I found is they are a tremendous partner now in not only our growth but also learning, because they will now give me information that otherwise we wouldn't have received. And so by being able to have those crucial conversations, I think you can also develop partnerships in the long run that will immensely benefit the growth of your program and your ability to take on new projects. And this leads into, okay, so you've gone through, you've gone live, you start having some of those learning experience. Well, how are you going to measure the outcomes? And Kyle will walk us through some of the different measurements that all of us are ultimately using right now.
Yeah, and these are probably things that look very familiar, are buzzwords in the industry. And I like talking to these because, I pride myself. I realize I'm a vendor. I pride myself on transparency, and it's a big difference. And one of the things I constantly hear touted is all these out of the box, KPIs and reports and things like that. And does my CMMS offer that? Of course they do. But the difference is I will be the first person to tell you that really doesn't matter that much, because if those KPIs and those reports are not tracking the specific metrics and data points and outcomes that you're looking to drive at your specific organization and health system, you might use 5 out of 200 canned reports or KPIs, which ultimately is not really going to do much for you. What is most important that I like to speak to a lot, though, is having those reports to act as templates to go get pushed into dashboards, to give everyone and give customers and clients and all of our healthcare organizations across the globe a solid starting point where you can go into the reports, go into the dashboards, identify these KPIs, but they're easily configurable, right? They're easy for you to change, they're easy for you to evolve, to copy, to use in different fashions. So they do actually fit your organization like a glove. The last thing too here is you'll notice those 4 bullets: customer service, employee satisfaction, turnaround time, and number of escalations. Those are all customer facing, right? So one of the things that I love that Dustin made on that last point is over communication. Those are all customer facing metrics that we use to manage our staff, to judge technician performance. And why not over communicate those with the clinicians? Right? Once again, it gets back to the employee satisfaction of the technician and the clinician of how easy it is to get things fixed for me, because this affects my day-to-day work, right? So there's no reason that we cannot let these people know and let the clinicians know which KPIs, which sort of reports, which outcomes we're measuring our employees by.
Great. And with that, this transitions very well into kind of towards the end where Kyle will walk us through a demo. But as you evaluate a project, ultimately you're looking for what was the financial impact. And what we've got over the next 2 slides is a couple of different ways you can measure this. Return on investment honestly gets a little tricky with cost savings initiatives. And so you can see here years 0 through 4 what your cost was. Your first 2 years you're out $10K each year, and then years 2 through 4 you've got that full $30,000 benefit. And so if you were to look at your cost in year 1 and then once you've got completely up and running, a very, very simple return on investment would be 300%. I'd be willing to bet if you took that to finance, they would look at you like either you're high or you don't understand math. But truly, it is a simple ROI. But that's why I would argue it's probably not the best to always present these as. So now another way to look at this is actually with the net present value. And what that is that's going through and saying, okay, with a discount rate of what we could get in an alternative investment, I can now present to finance over the course of these 4 years. At the end of year 4, if we were to get these dollars in today's money, we'd actually be looking at this particular project is really worth $52,000. And I think that it makes the conversation a little bit more meaningful. But the problem is this is looking at it in a silo. Really, this is looking at it strictly from a finance perspective. And so you need to start thinking about how is this going to improve employee satisfaction? In the case of the chemical sterilizers, how is it actually going to impact CP? How is it just us being able to be there within a couple hours instead of 2 days? How is that going to make central processing feel about the ability to get their equipment up and running? That's really the way we need to start talking about these projects. really out the gate, that $52,000, that's probably what's going to get you the go-ahead to actually send somebody out to training. But in terms of measuring this long-term, we need to be able to figure out alternative ways to measure this. And as an industry, I don't think we've got that completely figured out yet. I know downtime is huge, and there's also the correlation with what's the potential revenue impact associated with downtime. These are some of the things we're trying to figure out, but I don't know that it's not a perfect science yet, and I think we'll all continue to learn from each other. And so this leads us to our closing. Really, governance and setting up your business processes and your data structures and your data flows, it's all about making things easier. It comes down to what are you looking to do within your organization? How are you aligned with the organizational goals? If you're, a lot of times we're talking about cost savings lately. So what's in place now where you're actually measuring the cost of everything within your organization, especially full service contracts? Do you have clear enough visibility that when you take on more with your team, that you're able to say, we've gone from cost point A to cost point B? Being able to have a meaningful conversation around that and really a thoughtful discussion, that's going to help you determine where you are on your journey and what you may need to do differently, or what business processes you may need to change in order to be successful in the future. And that, as you're thinking through that, what are the key performance indicators that you're ultimately looking for as you go through that process? How are you going to identify that you're meeting the mark? And if that's your goal, there's the two things above, first and foremost, that you need to answer: why am I doing this, and who cares? Unfortunately, I've found at times I may be generating reports that sometimes I can't answer why or who cares. And when that happens, I stop generating the report, because that's time I can ultimately take back in my day to hopefully do something more meaningful that I can demonstrate why I'm doing it and who cares. So again, it's all about enablement.
Yeah, and just a quick note on this too. One of the things I see most in the industry is, from just working with so many different people, is that middle bullet there of where you are on your journey, right? This is key, because if we're not realistic about our maturity level and the things that we need to change and that need improvement, all we're doing is taking new technology and recreating processes that have deficiencies and gaps that we've been doing over the last 20 years, right? Many times these gaps are workarounds because of technology solutions that we've had to come up with. Everyone has them. It's pervasive across the industry. And just when we transition contracts and projects, it is a great opportunity to figure out where you really are and what you want to do moving forward, because it might be different than the way you've been doing it in the past. And so with that, I'm going to provide a real quick demonstration here, just around some reports and KPIs that we've been talking about so far. So I'll make this a little bit bigger. And these are just good reference to what we've talked about throughout this presentation, right? So this is just a standard Nuvolo dashboard. These are all KPIs I kind of just, or reports I created specific to this webinar that kind of back up some of the things that we've been talking about. What you'll notice, right, is it gets back to what I said earlier. It's not a perfect solution, but the difference is that you have all the data that we've talked about in terms of building that business case, at least in one place, in one central pane of glass, one source for you to pull it from, which is a great benefit. So first and foremost, looking at a time basis report to see when a particular model is under contract versus the same cost of that model when it's back to in-house. So if we look at this, right, well, part cost makes sense when it was under a contract were quite high, assuming we have the governance to collect that data. Labor relatively lower because we weren't doing a lot of the labor, and there were possibly a lot of it was getting covered under that contract. Same with travel. And then when we look at the report to bring the same model in-house, we can see that parts have been lessened because we're probably not receiving that percentage upcharge from the vendor. Labors went up significantly, however, because we're now doing the labor, so it makes sense. Travels went down because we've of course had in-house people working on this particular model. All of which is actionable. I can drill down and see exactly, what makes up that piece of the pie in any of these various different reports here. So scrolling down further, you have a nice little printout at the bottom. Also seeing travel costs. Some of the things Dustin's talked about is having that engineer who's on call and having to travel all the time, right? Driving hundreds of miles. If we can quantify that back against modalities of equipment, we know right away areas of improvement that we can utilize, right? Areas where it might make sense by looking at the infusion pumps here to see how much travel costs have went to this, to have more in-house technicians or put them on an AEM so we're not traveling so much to do it, even though infusion pumps aren't always a good example for AEM, but I think you guys get the point there. Also knowing what your certifications cost across your sites, right? So knowing what it actually costs to become a CBET, what it actually costs to go to a factory training or something along those lines across your different sites can be very, very important when deciding on bringing something back in-house. Looking at contract transitions, right? What you might want to see in some of these reports is tracking those and empty being the first year it was on, but seeing how those devices, that costs have hopefully dropped, and you hopefully will see sort of these same hockey stick effects that you're seeing here, because costs potentially should drop, because the reason we want to bring stuff in-house is because we want to cut costs on supporting that device. So just another example of how we can try and track those outcomes once we make those transitions. And then I think this is the last report. Oh, two more, sorry. Test equipment costs, right? So how much is it actually going to cost us based on what we have now to provide test equipment? And what's it going to cost us across our different facilities? So once again, knowing that utilization of where this is going to be used most is very, very important, because we know based on facility size about how much test equipment we're going to need of various different types. Lastly, on the job hours, right? So once again, with data governance, with sort of system control and architecting, it's really not hard to start getting some of these data points if we make it easy enough. That's one of the things Dustin's hit on a number of times, and creating shadow time entries and shadow parts replacements are all great ways to do this, because the technician's generally shadowing someone and on the job hours anyways, all of which results in a cost. Right, so knowing what certain individuals have spent in terms of shadow time or OTJ costs against different modalities of equipment, ultimately to find out what does it cost us to internally ramp somebody up. Right, having these numbers is very, very crucial in learning about competencies of your technicians and how long it takes and what it costs to become competent. So with that was the very brief demonstration we had. We're right on time, so that generally never happens, so that makes me happy. And from here, I'm going to kind of turn it back over to Linda, and we're going to go into a question and answer session here, but I'll also put the slide up thanking everyone, and has our contact information as well while we take questions.
Great, thank you so much, Kyle and Dustin. We've got time for a couple of questions. Can you use external reporting tools to evaluate contracts from data within Nuvolo as well?
I'm sorry, Linda, can you say that one more time? I think my internet got a little bad there.
Okay. Can you use external reporting tools to evaluate contracts from data within Nuvolo as well?
So yeah, I can talk to that quickly, and I'm sure Dustin has some points as well around, because I know that they use a lot of different BI tools and things like that, but you absolutely can. So any data you find in Nuvolo and a lot of other CMMS systems for that matter have a lot of really easy export capabilities. Nuvolo in particular, I can query, pull any type of data based on very specific, drop down and or sort of SQL-like queries, and export that out, or create scheduled exports to send it to a Tableau as a data source, or an Oracle BI tool, or whatever it may be. So yes, absolutely, you would be able to do that.
Okay, so if I want to track additional metrics around contracts and projects, then what is available now, and is that possible?
So for that one, I would ask what would be considered an additional metric. But for something, speaking of the ServiceNow platform and Nuvolo in specific, like I mentioned a couple times in the presentation, the system's very flexible. It's very easy to evolve. There's no limitations around how many workflows and notifications and new fields or calculated fields you want to add. So ultimately, what you can track as in terms of additional attributes of a contract is up to the customer. I always tell people that the flexibility of this tool truly is a curse and a blessing, because a lot of people overconfigure, they over-customize. It's hard to know what kind of new system you want before you've actually started using it. So many times, yes, you can, but I always like to push back and things like that as a consultant to see, well, what's the outcome? Once again, why are we using this to measure something, right? So absolutely, yes, I would just ask, what we're looking to add.
Okay,
the one thing I would add to that, and this coincides very well with our presentation, draw it out. I mean, ultimately, you're looking for something specific that you want to measure. Actually draw out a data flow diagram that explains, okay, here's what I want to measure. What are the inputs I need to track along the way in order to get there? And then really, the sky's the limit. You just need to ensure that you're set up appropriately as far as your business processes and your data flow and your governance to get the reporting needs that you have.
Okay, that's great. Well, we have popped over our hour, so I will wrap up now. So thank you, Carl and Dustin, for a great and very informative webinar, and thank you again to today's sponsor, Nuvolo. Just a quick reminder that the post-webinar survey and certificate process is automated, so the survey link will be included in the follow-up email, which you'll receive in about an hour's time. Once you've completed the survey, you'll be able to download your certificate immediately. If you have any questions, please contact us at webinar@mdpublishing.com. And for more information about all our upcoming webinars, please visit our website, webinarwednesday.live. Thank you once again for joining us today. Enjoy the rest of your day, and we hope to see you next week.
Thanks, everyone.